Okay, so just on the purpose for time, I'll run through the presentation rather than over and back between myself and Mairead. So just to be conscious of the time aspect. We looked at advancing and recognizing soft skills development within simulation, and myself and Mairead were part of a team that looked at this. And I suppose simulation has a broad and a long history in education and in nurse education, and it's seen as an interactive collaborative process that's centered around student learning and education using the technique of simulation. But the more recent literature on simulation is also emphasizing the importance of the real life events and promoting and encouraging those within the simulation experience. With that in mind and the history of the focusing in on the more physical assessment, the psychomotor skills that began in the 1950s with the simulators, there has been a move to more of the soft skills being incorporated within the affective domain and increasing those usage of the soft skills within our simulation practices. I suppose we've heard mentions of simulation earlier on and our skills earlier on and blood pressure and all those things. So they're more psychomotor, where we were looking more at the affective. So I suppose COVID created the opportunity and the landscape for us to reshape and take a breath, I suppose. It was unexpected and increased restrictions, but as I said, it created the opportunity for us to refocus and pivot and to reinforce and value the soft skills in nursing. And part of that was that, we could have the extra spacing and the restrictions and meet the restriction requirements a little bit easier as well. So it was an opportunity, I suppose, that we looked at it as. So we operated a co-design and co-creation philosophy, working with students, module leaders, our clinical partners, and the simulation team here in UL, and the learning technologist, which Mairead was at the time and has advanced to education technologist at present. So, this collaborated co-design process had a number of phases, and, first of all, to identify the simulations, to develop the policies and procedures and protocols that need to be in place, to develop the requirements that were mentioned by Anna in relation to operating the clinical skills laboratories in the COVID restrictions. And from there then went in to phase 2, which was about developing the actual case scenarios and working with the teams, our clinical partners, the simulation teams, the clinical skills teams, and the students, and gaining feedback upon the scenarios that were developed and the roles that were going to be incorporated within the scenarios. So there was input from all stakeholders involved. So to guide and assist the process as well and the people involved from all the stakeholders, we developed a number of policy documents and procedures, as I said, so around student information around the simulated learning environment, around the case scenarios, and as I said, there was feedback from all stakeholders throughout the process, the development of the scenario case simulation form itself, the participants, simulated participants, so sometimes they could be acting out roles, and what that incorporated as well. And I suppose to help and guide the process, timing and a rubric and the timetabling of the activity, and because we had to be in and out in certain times, 15 minutes between sessions for room clean down, others. So timetabling was an important factor to actually include within the simulation itself. And I suppose building on our prior learning with our online platforms and clinical skills, and I mentioned teaching clinical skills and the packs that are available, they continued as well simultaneously with the on-site clinical skills that were ran. So we focused in on 2 main soft skills which are in mental health and intellectual disability cohorts. Around risk assessment for mental health and medication refusal for people with intellectual disability. And as I said, the case scenarios were developed and just sample forms were developed and shared with the stakeholders, as I said, during the process. We ran the simulations. The simulations incorporated pre-briefing where everyone involved in the simulation process was briefed in relation to the role and the expectation prior to the simulation. And as I said, there was time allocated to the pre-briefing session. The simulation ran then in relation to the case scenario and abiding by the level COVID restrictions. And after the simulation, there was timetable debriefing session facilitated by the module leader, a moderator, and the educational technologist Mairead as well. And those debriefing sessions were, to focus in not on what actually how the skill was performed, but actually on the learning and broadening on the learning, relating it to policy documents, relating it to local and national policy and guidance for the students, but also for them to reflect and look in relation to how they bring themselves to a situation, their communication, all the other aspects of the soft skills. And that was important and needed time. The AV support was used for recording and uploading onto the platforms for the students, where they could actually, we could feed back the scenario to them and get live discussion going, but also then they could look at it afterwards, after debriefing sessions as well, if they so wished to reflect upon it. As I said, we operated within the restrictions at all times. We used the risk assessment and medical refusal just as the two scenarios to focus and reshape our clinical skills for they were 4 years. And I suppose part of the debriefing was important that we probably underestimated was it was their final semester and it was their only chance to come on campus and to do the skills. So, that actual, the social aspects of coming together, but also the transition aspect of completing and finishing their life and studies here versus in the university. We probably underestimated that as educationalists, and it's just something to acknowledge in the process. So I suppose, while there was great learning, and I'm not going to go into that because Anna dealt with a lot of the learning in the labs in the first presentation. I suppose what the take-home message would be the value of the debriefing and the unexpected things, and thinking, I suppose, of transitions and what stage the student is at in the works. So that's Whistle Stop Tour. I'm trying to claim back time, so hopefully I achieve some.
Thank you very much, Owen. Does Mairead want to come in now as well, or did you cover for both of you there?
I covered for both because of time, but Mairead can answer all the questions.
Sorry about that, Mairead. Thanks. We really ran over time there.
Not at all. No, it's lovely to be here and to hear everybody talking and to see all the lovely videos of all the different university settings. It's lovely to be here. Thanks.